Hello and welcome to Allied Physical Therapy. My name is Melissa Harkness. Myself and my colleague Elizabeth Padron are specialty trained in the area of pelvic floor physical therapy. We treat disorders of the bowel, bladder, and sexual functions. We want to give you some understanding of what to expect on your visit here with us and hopefully to alleviate any misconceptions or fears you may have. Pelvic floor physical therapy is really not any different than physical therapy. Physical therapy strives to alleviate pain, restore movement of your musculoskeletal system, and to promote normal function. And pelvic floor physical therapy isn't any different. It's just the location of the dysfunction that we're treating. We do accept insurances, including Medicare and most private insurances, and this type of physical therapy is reimbursed by insurance. The initial visit is typically the longest and is usually 1 hour in duration. You'll complete your paperwork in the waiting room, and then one of our experienced technicians will lead you back to a room where myself or my colleague will enter the room and begin the examination. The first part of the examination is your medical history and what led you to come to physical therapy. We would like to know any previous tests, procedures, surgeries, or other treatments that you've had prior to coming to physical therapy. And we'd like to get to know the best clinical picture that we can and the best understanding of what led you to your decision to try physical therapy for this problem. At that point, we will start the physical examination, and that consists of an orthopedic or musculoskeletal examination followed by the pelvic floor examination. The initial exam and the treatment is typically not painful. Sometimes there is some discomfort associated with just trying to determine the nature of the problem. If you already are in pain and that's the reason you're coming to visit physical therapy, we will just try to determine the nature of the pain and elicit that pain so we can determine the source of it. Some of the biggest questions we receive and the biggest fears are about what to wear and do we have to get undressed for physical therapy. So in terms of what to wear, we ask that you wear clothing that is easy to move around in and maybe good supportive shoes. But yes, we will be asking you to undress. Typically for the initial visit, we will ask that you remove the bottom part of your clothing, so pants and underpants. You can leave everything else on, and you will have a sheet to cover prior to us entering the room. And we will do that at your discretion and with your comfort level. And you are welcome to bring someone with you if you'd like to have someone else present in the room. Otherwise, it will just be myself or my colleague and yourself. Physical therapy visits, the number of visits and the duration of time that you're in physical therapy for your specific problem will vary. However, based on the nature of the problem, we will come up with a plan of care on the first visit and we will discuss that with you. Typically, it's once or twice a week for up to 8 to 12 weeks, depending on the nature of the problem.